Really useful listening to Louise's description of being able to engage and sticking with understanding people's real experience and what's meaningful to them. And so what I wanted to talk to you a bit about this morning is the work that we've been doing with local authorities across Wales and looking into unpicking the barriers that prevent statutory services in many ways doing that for the people they care for. So I'm really going to be thinking about how we release that understanding and insight about what really matters to people, and how an organization needs to adjust and change to support that. So I'll just share my screen with you. You all got that? Is that okay? Brilliant, thank you. So as we said, my name is Rhoda Emlyn-Jones. Background is social work, and for the last 8 years I've been working alongside Social Care Wales in supporting local authorities in the rollout of the Social Services and Wellbeing Act. When that act came out, people were thrilled to see it, because for so many it captured their own professional ambitions and how they wanted to work in an empowering way, engaging people, enabling people. One of the things that Social Care Wales noticed, however, was even though people embraced the act, they were finding it very difficult to make it work on the ground. So they were keen to develop programs of transformation that helped those organizations through that. And my program is part of that process. So I'm just going to share with you some of the things that we've learned. Importantly, how we think about something affects what we do. We're thinking about now outcome-focused public services, not the process of how we deliver services to people, but to what end? What is the impact? What does each unique person and family and network that we meet need and want in terms of a good enough outcome? And how can we walk alongside them to achieve that? But first, we have to really understand what it is and help people to articulate their outcomes. So Louise's work in Dundee and others who are really committing to understanding people's perspectives is incredibly important. We can do it in every conversation. We can shift the way we think, and in every conversation, explore what really matters to people. But it means supporting a skilled workforce. So at the heart of the work we do is finding ways in which we can help people release their skills, develop their skills, be valued for their skills of communication, not just for the specialist knowledge they have, but for the core skills that helps them understand and discover with people what the most important things are. And there's, over the decades, those of you who've been in this work for a long time will have seen incrementally the growth of processes. More and more time spent on paperwork, processes, procedures, filling in forms, inputting to computers, multiple assessments that really dominate everyone's lives and are so difficult for service users. Risk assessment, signs, agreements. Arguably, no child or adult, vulnerable child or adult, is safer in Wales because someone's filled in a risk assessment document. The issue is about how we engage with people and help them understand where their risks lie and how we can draw on and help them draw on strengths to offset that risk. Arguably, no one has more sense of an ownership of their plan because they've signed an agreement with an organization. So we really have to think about where we put our energy, where we put our work, but it's estimated 80% of our time is going into these systems, leaving less and less time to do the important work of engaging with people. One of the things that's happened over time, and this is what staff are telling us over and over again, is the process-driven culture in their organizations disengages them from their work. They struggle to do the things they came into the work to do in the first place. And some of the illusion of control that comes from thinking we've got processes in place, we can test quality, we can see whether the forms have been filled in and the files are up to date. I don't know about you, but I remember in the past, auditors and inspectors coming to me and saying, Rhoda, we're going to go out and see all the families that you serve, or not all of them. We're going to meet with families that you serve and ask them the impact of your work and the quality of it and how it's affected their lives. And we'd say, oh, that's fantastic, because we need that. We're doing that, but we need that objective view of how people are feeling there, that our services are impacting. We don't want to be busy. We want to be useful and valuable and effective in empowering people. But then one year they came and they said, we haven't got time to do that now. Go out and see the families. So we're just going to randomly select some files from your staffs, and then we're going to check that they're all up to date. That was the moment we moved from quality assurance into quality control. And everybody's efforts went into controlling that output. And often it was driven by fear of blame, fear of being judged for not having done the right piece of paper in the right time. So some of the unintended consequences in our staff was fear, definitely risk-averse decision-making. Because if you're fearful of blame, then you're going to go with the thing that keeps people most safe, even though that might curtail the autonomy, self-determination of the people we're here to serve. So our decision-making started to become more risk-averse. That meant our staff lost a sense of autonomy, and what went with it was their creativity. So everything that Louise was just talking about the creative way in which we understand how people function and what's important to this person and this family gets lost. It also brought with it apathy and anxiety, a really painful mixture for our staff, because at one point the apathy is the organization's too big, it's beyond us, we can't do anything about it. But then coming with that, underlying that, is the anxiety that we're not doing the best thing we're doing. So we're creating those feelings. People became increasingly dependent on processes. So people would come into the work full of enthusiasm for engaging with real people in times of challenge and change and crisis. But they're asking, what forms do I take? How do I fill them in? What does this process, how long have I got to do this? We've disempowered people. And we've also created a lack of trust in organizations, and that leads to lack of transparency. People are not telling us how they feel because they're not sure that they're going to be listened to. So if we think about that illusion of control, we meant well, but it created this kind of atmosphere over and over again. And it gets passed on to the people we're here to serve. So often, and I work across all organizations, child protection, adult services, a wide range, there's a sense in our service users of fear, their own risk-averse decisions, diminished autonomy in their own lives, and stifled creativity. So the same feelings get passed on. Both these groups of people are now very stressed, and stressed people make poor decisions. So we created a kind of system that is a maelstrom of stress, worry, pressure. And within that, it's so hard to create an environment where people can think, about what's most important, where things can be calmed down enough for everyone to empathize with each other, think about what's most important. So we're thinking about how we can get back to that space that really allows people to think and talk. Just quickly, to some of the old beliefs that were held in the organizations were that problem-based reasoning leads to our duty of care. So if there's a big enough risk, if there's no big enough problem, then we'll provide something. Rather than understanding the nature of what's going on in people, understanding what's most important to them, and truly understanding that most people want to be in control of their own solutions. They need people alongside them to help with that. But most of us do not want to be told what to do. We don't want to be told what our risk is. and how we're going to keep ourselves safe. We want to be part of that, collaborating in that conversation. There was a traditional belief that services are needed, are what's needed. So many outcomes in care plan, and I've seen many care plans, thousands of them, ended up with the plan being a service. Service isn't an end. A service is a means to an end. How do we know what that service is helping this person to achieve if we haven't had the proper conversation? So services are not an end, they're only a means to an end. And in certain circumstances, people were even judged about whether they turned up to those services or not. So not only we'd made the services the end, but now we're judging that person who's choosing not to attend the drug and alcohol service or the family group. And in some instances, that judgment has been used to assume that therefore people are motivated to be a better parent or to improve the situation in their lives. So we made some really massive assumptions about people. There is a sense that risk has to be eradicated in order to keep people and organizations safe. And we all know that risk is part of all of our lives. To eradicate it means such a reduction in autonomy and freedom that we damage people's well-being in an attempt to keep them totally safe. And through my whole working life, thresholds have been a massive source of conversation, as if somehow we can decide what's fair in terms of access and delivery of services by understanding what the threshold needs to be. And mostly that was problem driven, not person driven. It wasn't to do with how people felt in their lives. It was about, we create a uniform thing that we then respond to in terms of fair access. But actually what we are more and more recognizing is that we get increased engagement when people are helped to find their own solutions, that relationships are improved, then waste in the system goes down. We don't need all those assessments. We don't need all those processes. We don't need to take a referral and then make 5 other referrals to other organizations. We can engage with people. It reduces waste. If we have cornerstone elements of reflective practice in organizations, we have line of sight to every case. That is true accountability. That is true quality assurance. But you ask most organizations whether they have a chance to go and think and talk about their decision making. Very few have quality spaces to do that. So we just are going round in our own heads, facing some complex and unpredictable situations without a space to talk things through. So if we have reflective groups, we have line of sight, which is accountability, and we learn from each other and we learn for ourselves. And what we know about fair access and a sense of satisfaction in the people we're here to serve is that the more compassionate those relationships are, the more likely it is that people will hear what they need to hear and be able to act on those real issues. So now across Wales, in the work that we're doing, we work with thousands of people, hundreds of teams, many local authorities and health authorities, and we're seeing a very different flavour of the description of their work, the impact of the work, and the way in which they understand the impact of their work. So people are being freed up. Many workers saying to me, I've got my mojo back. I was feeling burnt out, but I got my mojo back because this is what I came into the work to do in the first place. This is what I care about. And all those traps of conversation that goes with the old world ended up with people feeling that they were the experts, they were responsible for fixing things, that they had to come up with the solutions to the problems, that if they asked enough information and wrote enough down, somehow the meaning will appear in it. Actually, we have to trust our skilled staff to have really important conversations with people in a skillful way, and the meaning will emerge. Let them write that down, because no one read all that other stuff which overwhelmed and was so often problem focused and risk focused. So the old system drove people into having a conversation based on the assessment questions, not on what they were really feeling is happening in this family. So they weren't engaged in the dynamic work. They were going through a process so they could fill in the machine when they came back. And it felt wrong to them. It feels wrong to so many people. They were driven to think that they had to be responsible for services, that we as public services are responsible for the input and the output. And actually, it's the people. What is it about their lives? What strengths are there in this family? And what would make a difference to them to improve things a bit so they felt more in control, more in the driving seat, feeling that their well-being was improving and truly that they were listened to and understood. So we have to understand the nature of the organizations, the way they've gone. This has taken a long time to get where we are, but all across the country, workers are feeling empowered and freed up to do something different. Spend time with people, listen to people, engage with people, use your skills before you turn it into a plan that then gets monitored and maybe so far away from what people need and want that it is damaging rather than enhancing people's sense of empowerment. Where this is working, we are seeing hugely increased well-being in staff. We're seeing far greater satisfaction for service users, much better outcomes, and less waste of those valuable resources, because partly people say, well, we can't do this, we haven't got time. If we can take away some of these damaging, curtailing scaffolding, then people do have time. They have time to do the proper work, have the best beginnings, really engage on what's going on, and that affects outcomes. Less people are in care, less children are in care. Because if we just go through the old route, we end up putting people tighter and tighter into that scaffolding. Let's trust our staff. Let's listen hard to them.